Good morning, everyone. Today, our topic is filariasis. So now, the term filariasis, or you can say lymphatic filariasis or subcutaneous filariasis, is basically the infections which are caused by nematode worms, and I'm going to tell you the name soon. And there are different nematodes which can cause, you can say, either lymphatic filariasis or subcutaneous filariasis. So now, uh, to tell you like a little about the background of this condition. Of course, like as I told you, I'm going to first of all talk about lymphatic filariasis, and then I will talk about a little about micro, or you can say subcutaneous filariasis. So uh, one thing, remember, like this is a condition which is caused by nematode, okay, and that's why I did not put lymphatic or subcutaneous, because there is two forms. One is called as lymphatic and one is called as subcutaneous, right? So subcutaneous, as the name shows, okay. So now, also there is serous cavity filariasis. So simply, filariasis can be number one, lymphatic, okay, filariasis, okay, it could be subcutaneous filariasis, it could be serous cavity filariasis, okay. Now, so see, there are three types. Now, um, the important thing over here is uh, we are going to talk in detail about lymphatic filariasis in this lecture, right? But to tell you the importance of all these three, all the things, it's better to mention them first and then go on to lymphatic filariasis to tell you the details of that. So simply, all these are caused by a nematode infection, right? Nematode worms or nematodes are there. Okay, so nematodes, they are nematodes. So now they belong to a family which they name it as Filariasis. Okay, so see, because they cause filariasis, so they name it like this. Okay, so they are thread-like worms, and that's why they are called as phyla or phyllium, because phyllium means thread. Okay, so now these thread-like forms or nematodes, which belongs to this family, they can reside in the subcutaneous tissue, they can reside into the lymphatic system, they can reside into the body cavities, okay, and and that's how they cause infections. Now, you can say that this one, lymphatic filariasis, I will show you this one. See, they have given different names over here. For example, you can see Wucheria bancrofti. Okay, so this one, and Brugia melai, this one, and there is one more, B. timori. These three, okay, or here, like they have mentioned these two, they cause mostly lymphatic filariasis. And then Loa Loa, as well as you can see this one, Mansonella, Loa Loa, this one, okay, it causes subcutaneous type. And this one, Mansonella perstans, or like the other types, they causes cavity or serous cavity filariasis. Okay, now see, they have shown the shapes, they have shown like how the posterior end is, how the tail nuclei is, how the anterior end is, what is the size, either they have a sheath or they are without sheath, and where they live. Okay, so uh, of course, like it's very hard to remember all these things, right? Not for you guys, but for anyone. Okay, uh, but simply you can say the adult worms, the males are longer than females. Okay, and the tail of the male worm, have mostly perianal papilla. Okay, now uh, you can say in some of the species, the microfilaria, they retain their egg membranes. Okay, they retain their egg membranes, so they are called as sheathed. And those who cannot retain their egg membranes, they are called as unsheathed. Okay, so of course, like uh, here they have shown one, two, three, four, five, six uh, subspecies. As well as you can see over here, uh, this one, what you can say, Bancrofti and Malai and Timori, they are lymphatic one, Loa Loa and Onchocerca volvulus, as well as Manzonella streptocirca. They are subcutaneous one, whereas Manzonella azardi and Manzonella uh, perstans, they are serous cavity filariasis, right? So now you can see over here, of course, location in the body. These three lives in lymphatics, these three lives in subcutaneous tissue, these two lives in the peritoneum as well as the pleura, because they cause the cavity or body cavity filariasis. So you can see like the microfilaria of these three of these all are in blood. This one is skin or eyes, skin, and they also reside in the blood. So you can see, like, of course, as I told you, it's very hard to remember each and everything, how to differentiate rather. So that's why uh, these are the organisms which causes lymphatic filariasis, as well as the one which causes subcutaneous filariasis, or they can cause serous cavity filariasis, right? So basically the condition is filariasis. Now the important thing, I am going to talk in detail about Bancrofti, by the way, because you have to catch one of the main organism and then you have to talk about that. So I choose, like, I'm going to talk about this one. So I will not talk much about like this Malai and or Timori, but rather I will talk about that one. But just to tell you, for example, Loa Loa. Okay, so this Loa Loa is also called as African eyeworm. Okay, I can show you how it looks like by taking the help from the Bing, Loa Loa. Okay, so see, like here they have the photograph of oh, this one. Okay, how this Loa Loa looks like, right? So now this Loa Loa, it causes a condition called as Loa or Loiasis. Okay, so see, basically, if you will see over here, you can see the worm in the eye, right? Or you can see over here, see, you can see the worm in the eye. Okay, so basically this one causes uh, eye condition. Okay, so this eye condition is called as loasis. Okay, or loiasis. This is called as loiasis, right? So now this loa loa, uh, it is present mostly in Africa. Okay, so now the definitive host is man, but the intermediate host, not for this one, but rather for everyone, is a fly or a day biting fly or a mosquito. Okay, so now you can see that this one, it is the one which you can say it reaches the eye. Okay, so what happens is basically when someone is bitten by this one, okay, the infection is transmitted to human by the bite of the infected fly. Okay, and they put that one in their blood. But after that, like this organism, it entered the subcutaneous tissue. Okay, and they develop into the mature adult. And what you can say, like due like by the blood, they can reach into the eye and see, like they can develop like this one, filariasis, right? So this one is an example of what you can say. Uh, this one, loiasis. Okay, for example, I will show you one more one, which is called as, see, this one is, okay, this one is uh, Onchocerca volvulus, right? Which is the also one of the type which I show you over here, right? Uh, this one. Okay, so it also causes subcutaneous one. So you can see over here, this one also cause a condition, or this is also called as blinding. Uh, so blinding filariasis. So you see, like it can make the patients blind. So you can see over here, over here, over here, right? It can make the patient blind. It is also called as river blindness. Now, this one is also more common in Africa. So it is mainly found in Africa, also in South America, but mainly found in Africa. So now it also have the definitive host as man and intermediate host as a day-biting female black fly. Okay. So simply, this is also the one which affect the eye. Now, for example, I told you there is filariasis, which are also affect the cavity. So I can show you that one, and then we will talk about the Bancrofti. So Mansonella ozardi, right? So this is one of the organism, Mansonella ozardi, right? So this Mansonella ozardi, this one they live in the body cavity like the peritoneal cavity or the pleural cavity, right? So simply it can cause the condition related to that. Okay, so this is how it looks like. So rest, like we are going to discuss today mainly uh, Bancrofti. Okay, this one. So I will show you the worm first, or I can tell you the bank. What you can say. Basically, this one, lymphatic filariasis. We are going to discuss this one. That is Chervia Bancrofti. Okay. Now remember, I told you there are also other organisms which is called as Brugia malai as well as Brugia timori. Okay, so now the important thing over here, basically these one causes lymphatic filariasis, right? So all these three parasites, okay, they are transmitted by the bite of infective mosquito, and now uh, they live in the lymphatics, right? They live in the lymphatics. So in the lymphatics, what happened? Like they reproduce, they give rise to microfilaria, which circulate in the peripheral blood, and then they are available for the mosquitoes again to feed on. Okay, uh, this condition or the lymphatic filariasis is not a fatal disease, but it can cause a lot of deformity and disability. Okay, I will tell you now. I'm focusing my discussion on Bancrofti. Okay, now guys, remember this thing that lymphatic. Like we are going to discuss this one, lymphatic filariasis. Okay, now this one is a global health problem. It is estimated that right now over 2 billion, which is a lot of, you can say around more than 30% of the world population, is at risk. I'm not saying they're infected, they are at risk, but 130 million people are infected by this one. Okay, so that makes a very this condition a very gives very too much importance to this condition. So now why I am choosing talking about this Bancrofty, not about this, because whenever the people have lymphatic filariasis, Bancrofty accounts for more than 90% of the infections are caused by Bancrofty, and less than 10% these two. But more than 90% of the times, it is Bancrofty which causes the infection, right? And that's the reason I choose talking about this one, okay? Like why I'm talking about this one mainly. Now, uh, this one, Bancrofty, okay, Bancrofty have large geographical representation or distribution. It can affect it is present in the Africa, in Asia, in Latin America. Okay, so now what happens, we will discuss the life cycle soon, but Bancrofty, there is humans which are the definitive host and the mosquitoes are the intermediate host. Okay, and the life cycle is very complex because there are four larval stage and then there is an adult stage. So now to talk about the life cycle, before talking about the life cycle, I want to show you the Bancrofty, okay, or the microflaria of the Bancrofty, or and the adult worm of the Bancrofty. Now you can see over here, this is the adult worm of Bancrofty, right? This is the you can see the male and female, right? The female is larger as usual and the male is smaller. Okay, the males, or you can say the adults, like they are whitish in color, they are thread-like worms, and they have tapering ends. See, they are tapering at the ends. Okay, so now the female posterior end is straight, whereas you can see the male is curved. Okay, now uh, the males and the females, they remain, you can say, I will show you over here, uh, W. Bancrofty. Okay, okay, this is the microscopic form, but I will show you. Sorry. Okay, wait. Okay, they are not showing. Yeah, this one I will see. I will show you. Like, they are intermingled, or you can say they are formed in a coiled form. Okay, um, in the lymphatics. Okay, and this is the microflaria. And the microflaria, they are colorless, and they have more like a blunt end instead of this tapering end. Okay, you can see over here, and we can see like a lot of nuclei. Okay, like this one, there is a anterior V spot, there is a posterior V spot, and there is a tail, and there is phallic hand, and okay, so this is how we identify them. Okay, so now the important thing is the life cycle, guys, about this one. See, the life cycle is of Bancrofty. It have the human stage, it have the mosquito stage. So now, as I told you before, the humans are the definitive host, whereas the mosquitoes. Uh, so um, the mosquito one are uh, the one which are the intermediate host, right? So now I'm thinking like from where to start, but okay, they have given number one, so we can start from here as well. But to before starting, the life cycle of this parasite involve four larval stage. You can see like L3, L1, okay, L3, L1, L2. So there is L4 stage as well, and then there is adult stage, right? Now you can see like the infection begins when there is the deposition of the infective stage. So where is the infective stage? You can see like this is the infective stage. See, infective stage. So this is the infective stage. So when the infective stage L3 Okay, they enter the skin through a puncture wound which is caused by the mosquito. See, they are showing the mosquito from a very close. So the larva then pass through the puncture wound and reach the lymphatic system. So when it reaches the lymphatic system, so within the lymphatic system and the lymph nodes, the L3 larva form undergoes molting and develop into L4 form. Okay, so this takes around, you can say, 7 to 10 days for this thing. Okay, so now the L4 undergo again molting and development to form the adult form. This will occur around in 4 to 6 weeks. So you can say it takes around 5 to 7 weeks from L3 to the adult form. Okay, in total. So L3 to L4 it takes around 7 to 10 days, but the L4 to adult it takes around 4 to 6 weeks. Okay, so this means like around 4 to 6 weeks after the entry of L3, basically the adult forms are formed. Okay. Okay, so sometimes it takes even months. Okay. Now the adult worm, what happens? It take permanent residence. You can say it can take a green card in the afferent lymphatics, and then they keep on generating microscopic microfilaria, or you can say over here they have shown microfilaria. Adults in lymphatics, adults produce sheeted microfilaria that migrate into lymphatics and peripheral blood circulation, right? This is the diagnostic stage, you can say. That's why they make a microscope over here, right? So now the adult worms, once they're in the lymphatics, they keep on making this microfilaria. The female worm can give birth to as many as 50,000 of them per day. So they enter into the blood, they enter into the lymphatics. Okay, the adult worms, they are estimated to survive for a period of 5 to 10 years, but even longer durations have been recorded. So imagine how much microfilaria they can form. Okay, so when simply someone have this thing in the blood or in the lymphatics, now the mosquito, or the mosquito basically, which is culicine mosquito, which is found in mostly urban and semi-urban areas, and Anopheles mosquitoes, which are found in mostly rural areas of Africa, and Aedes mosquito, which is endemic in Pacific Islands. Okay, so what happens, like all these mosquitoes, what happens is they will bite, they take the blood meal, they ingest this microflora, and then this microflora have the outside life cycle in the mosquito, right? So this is how its life cycle is completed. Now, guys, the important thing that microflora of Bancrofti, uh, they they show a, you can say, a phenomena called as nocturnal periodicity. Like they appear in large numbers during night in peripheral circulation. Remember, like if it is in the lymphatics, the mosquito cannot take it. So in the night, they can be present in circulation, mostly in circulation in the night, and in the day form they return back to lymphatics. So that's why whenever the mosquitoes will bite during the night, they have high chances to take this one. Okay, so this is one of the point you have to remember. Now, guys, you can see once in the mosquito, the microflaria shed sheets, penetrate mosquito midgut and migrate to thoracic muscles, and one larva, then they change into L2, then L3, and then migration to mosquito head and proboscis. So what happened, like then they will bite the human again, and then they will cause this thing. Now, guys, about the clinical feature, lymphatic filariasis, they can present with variety of subclinical and clinical features. Now, what is subclinical? When they have this condition but they don't have any symptoms. So remember one thing in clinical features, one of the thing is asymptomatic, which we call as subclinical infection. So there are asymptomatic patients, okay, in which like they have subclinical microfilariemia, means the microflora are in the blood only. Okay, so in areas endemic for lymphatic filariasis, many individual exhibits no symptoms. Okay, and we can just catch them on routine blood examination. That's it. Okay, but they are the one which can spread it to other, like before, because if a person who have subclinical microfilariemia, when the mosquito is going to bite it, the mosquito can transmit this one to other people. Okay, so simply these people are asymptomatic, they don't have any symptoms, but these patients are those which are the carrier of infection, and they can spread this thing to other people. Okay, but the parasitic burden in these individuals can reach to very high numbers. You can say around 10,000 microfilaria in 1 ml of blood. Okay. Okay. So nowadays, of course, because we have blood tests, so we can diagnose this stage. That's a very good thing. Okay. But the thing is, like, uh, what happens uh, nowadays, because we have a very good blood test and very good imaging machines or imaging techniques. Nowadays, what they found, like all the patients who have microfilariemia or who are asymptomatic, okay, they don't have any clinical features, but they do have the microflaria in their blood. What they found when they did imaging in these patients, what they found, like all these patients who have microfilariemia have some level of subclinical disease. Like what they found, like they found some changes uh, in their lymphatic system or lymph vessels. Like they found like their lymph vessels are dilated. Okay, some of them they found like they have increased flow of lymph in them, right? So they found, like you can say, a lot of subclinical type of things, are there. Some of them they found like they have scrotal uh, lymph angiectasia. Okay, so they found like these things in these patients. Okay, in some of them they found microscopic hematuria. Okay, so they found like these things, or proteinuria, like they are losing proteins as well as blood from the condition. Okay, so this is about asymptomatic people, right? This is about asymptomatic people. So I will make this slide as, so in some of the patients you can say what they found is microscopic hematuria as well as microscopic protein urea. Okay, these things they found. And then there is a condition called as acute clinical disease. Okay, now the acute manifestation of lymphatic filariasis is characterized by recurrent attack of fever, and there will be lymphadenopathy, like the lymph nodes will get enlarged or inflamed. Okay, we call it as lymphadenitis or lymphangitis, you can say. Okay, so they have recurrent attack of fevers, they have lymphadenitis, they have lymphangitis, lymphadenitis and lymphangitis. Okay, so LIMP, lymphangitis. Okay, so this is about acute clinical disease. Like these patients, they present with lymphadenopathy, recurrent attack of fever, lymphadenitis, lymphangitis, all these things, right? So now the lymph nodes which are commonly involved, by the way, they are either inguinal, axillary, and epitrochlear. Okay, these lymph nodes are mostly involved. So, and in especially like in males, you can say lymph nodes of, or you can say male genitals lymph nodes. Okay, so make it easy. So that's how these patients present. So like many of them, they have, for example, in males, they may have epididymitis or orchitis, which is the inflammation of the testes. So this is how this condition present, like acute illness or acute clinical condition present. So we also call it as acute filarial adenolymphangitis. Okay, acute filarial uh, adenolymphangitis. Okay, so it is believed like that this is like immune mediated inflammatory response to the dead or dying adult worms. Okay, so simply like this is the condition of how this condition present as acute clinical disease. Sometimes, for example, they may have um, funiculoepidydymyorchitis. Now, what is this? The thing is not difficult. Like simply, funiculo means what? It is funiculitis or inflammation of the hair. You can say the hair bud. Epididmo means inflammation of epididymus. It is present in the males. Orchitis is the inflammation of the testes, right? So it presented with pain and tenderness in the testes in the males, right? Or it could be like acute dermatolymphangitis. You can say like the inflammation of the lymph vessels as well as the skin. Okay, so this is how this condition present. But sometimes the patients, they can enter around 10 to 15 years after they can have a condition which we call as, I will show you, or I can write over here the chronic manifestations of this condition. uh, okay, wait. This is basically the chronic manifestation, or what we say like chronic infection. Okay, so basically when the patients, they have chronic infection, the chronic manifestation of filariasis, like approximately 10 to 15 years after initial infection, the patient present with different features. Like this condition is called as elephantiasis. Okay, because see, like the skin or the leg looks like an elephant, right? Or it can present with lymphedema, elephantiasis or lymphedema, or it can present as a hydrocele. So you can see lymphedema, 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 or elephantiasis, okay, or hydrocele. Okay, so the manifestations which can occur, hydrocele or swelling of the testes is very common. Then comes elephantiasis. Okay, like you can say elephantiasis of the entire limb is there, right? Or entire arm or the vulva or the breast, or you can see over here, see very severe conditions, or the genitals. Okay, so simply whenever the patient, they develop these conditions like these features, these elephantiasis, lymphedema, or hydrocele, guys, we have to grade it. And how we grade it, or the grading is done like there is grade 1. Okay, when they have pitting edema, reversible on limb elevation. Or there is grade 2, which is again pitting or non-pitting, not reversible on limb elevation, but with normal skin. Okay, and then there is grade 3, which is non-pitting now, non-pitting edema of the limb, not reversible, and with skin thickening. Okay, and then the last one is grade 4, which is simply non-pitting edema with fibrotic and verrucous skin changes, or simply what we call as elephantiasis. Remember, when the skin changes are there, we call the condition as elephantiasis. So in men, scrotal hydrocele is the most common chronic clinical manifestation. Okay, and we call like manifestation of, you can say, Bancroftian filariasis. Bancroftian filariasis means what? Simply which is caused by Bancrofti. So what is hydrocele? It is accumulation of the fluid in the cavity or in the tunica vaginalis of the testes. Okay. So chronic epididymitis and funiculitis can also coexist. Chyloceles can also occur, and which will lead to chyluria. Like in the urine, there will be a lot of excretion of the chyle is there, which is a milky white fluid in the urine. Okay, but the incidence is very low. So in the male, this is the most common manifestation. So now, guys, uh, not just these, like there are many other manifestation of these conditions, or you can say like the other manifestation of this condition, other manifestations of this condition. One thing is called as tropical pulmonary eosinophilia, right, or TPE. So this is a syndrome that develops in some individual with who get infected with Bancrofti. Uh, it affects mostly the males, 4:1, and during the third decade of their life. And the majority of the cases are seen in India, in Pakistan, in Sri Lanka, in Southeast Asia. And the main clinical features are simply they present with paroxysmal cough, with wheezing, which is usually nocturnal or usually during the night. Okay, so why there is nocturnal cough and wheezing? Because remember about the nocturnal periodicity of microflaria. I told you, like in the night, it occurs in the blood. So they present with weight loss, they present with low grade fever, adenopathy, and in their blood we found a lot of eosinophils. So the chest x-rays come back as normal, but the CT scan can show some findings. Test of when we perform pulmonary function test, it shows restrictive pattern. Okay, so this is one of the manifestation of this condition. Also, sometimes this lymphatic filariasis also is presenting or is associated with renal abnormalities. Like I told you, microscopic hematuria, microscopic proteinuria. It can lead to nephrotic syndrome, glomerulonephritis, and that is simply due to circulating immune complexes which go and causes renal damage. It can also present as monoarthritis, okay, of the knee or of the ankle joint. Okay, sometimes like it can give some other features as well, but like they are not so common. So that's it. Guys, how we diagnose this condition? The traditional method of diagnosing lymphatic filarial disease is by detection of the microflaria in the peripheral blood, usually collected during the night. Why? Because I told you it shows periodic or nocturnal periodicity. Like during the night, it present more in the blood. Okay, so we can do this one. So the simplest method is what? Like they collect the blood from the patient and they stain it with Guymaza stain. Okay, and they see it under the microscope, or they can sometimes use the concentration techniques as well, okay, to concentrate the solution, and they see it under the microscope, and they use some stains and they can see the microflaria in the blood. So this is one of the diagnostic technique, you can say. Okay, Rest, you can see a lot of other things are done. For example, indirect evidence like eosinophilia, I told you, in the blood can be seen. They can detect the adult worm by doing a lymph node biopsy. On X-ray, if worms are calcified, high frequency ultrasound or Doppler within the scrotum. Okay, these things can be done. Then you can see like immunodiagnosis. Again, the same story. We can do ELISA. We can do immunochromatographic test. Okay, both tests have very good sensitivity. We can do antibody detection tests like complement fixation test. We can do go for other tests like indirect hema agglutinin test or indirect fluorescent antibody test, or we can go for molecular diagnosis like PCR, right? So simply all these tests can be done. Okay. uh, Sometimes, as you can see over here, ultrasound can be used as well for the testes, for the scrotum, for the breast. Okay. And Doppler techniques, why? Because like Doppler techniques, they can identify, or they can catch the moving thing, so they can catch the moving filaria or the adult worms. So guys, how to treat this condition now? uh, Treatment of this condition, one of the drug which is used is called as diethyl carbamazine. Okay, this one is a drug which is used, and it have both macro and micro filaricidal properties. Like it can kill both the micro as well as the adult forms. Okay, so this one is used for the patients who have active lymphatic filariasis and also microfilariemia in the blood. Albendazole can be given, but for 21 days. Ivermectin can be given. Okay, so now, but remember guys, whenever someone have chronic disease or lymphatic filariasis and they have the condition which is affecting their limbs or the skin, then we have to take care of their hygiene. Okay, we have to prevent secondary bacterial infections in those people. Okay, as well as we can give them physiotherapy. Okay, now because the dimensions of the thing is changed, and remember we will go for surgical management because of that deformity. Of course, like surgical managements are there. So of course, like treat the infection, take care of their hygiene, and for example, if someone have hydrocele, should be evacuated, managed surgically. Okay, this thing. So of course, like then surgical management is there in these patients. So now, how we can prevent this condition? We always talk about this thing, prevention. How the prevention can be done? So now, prevention can be done. This drug, we have the beautiful drug diethylcarbazine or DEC. So you can say we can give them. Sorry. We can give them prophylaxis. Okay. Number one, we can give prophylaxis, and for the patients. Okay. For prophylaxis, we can give them ethyl carbazine, or we can also give albendazole, and that's very good. Like it is used in many parts of the world to decrease the to kill that things. We can control the vector. So as you know, what is the vector? The work vector is like mosquito, so you can use insecticides. Okay. Uh, of course, like this thing can be done. So this condition can be, you can say we can eradicate this from the world. Okay, And WHO is running some programs to eradicate this condition. Of course, until now, of course, like the eradication is not done, but WHO is running programs to eradicate this one, to interrupt the transmission. All the people who are, all the areas which are endemic, they are giving them drugs to kill the filaria or microfilaria in their blood. Of course, like when we kill them, the mosquitoes cannot feed on them and they cannot transmit them. So that's all, guys, for this condition, filariasis. I hope you understand, and I hope you like this lecture. Thank you so much for listening.